we've already done Mr. Crosby's vital signs. His blood pressure was 138/81. He has an oxygen saturation of 96%. His heart rate's 100. He's 20 and unlabored with his breathing. His temperature was 98.6, and he is in no pain today. Is that all correct?
Yes.
Wash my hands. First thing I'm going to do is assess Mr. Crosby's skin. I'm going to look at his skin for any rashes, growths, lesions, or scars. Sit up for me. Sit back for me. Which I do not see. Mr. Crosby's skin is normal for his race. It is warm. It is dry. I see no diaphoresis. I see no edema anywhere. The temperature is normal, and I do not see any varicose veins. No varicose veins. See your hand for a second. I'll check for tinting, which he does not have. No tinting noted. All right. I'm going to check your spine for scoliosis or kyphosis, which is curvature of the spine or a humping of the spine. If you could stand up for me. It's this one. And just bend over for me. I do not notice any of scoliosis or kyphosis. You can sit back down for me. Next, I'm going to assess Mr. Crosby's head. I'm going to check for symmetry, which symmetry is normal to both sides. There's no deformities noted. I'm going to check for any lesions or scars, which I do not see. I'm going to check his hair for texture, which is normal. His hair is thin. He does have some balding patterns that are normal for his age. His hair is clean and free of debris. Next, I'm going to assess Mr. Crosby's nails. I'm going to look at his nails. I'm going to check him for the contour, which is normal. His nail beds are pink. His capillary refill is normal. Check his toenails also. His nails are clean. Contour is normal. Color is normal. His nail beds are pink. No clubbing or spooning noted. Next, I'm going to assess Mr. Crosby's face. I'm going to look for symmetry in the eyes, nose, mouth, ears. His ears are symmetric on both sides. His eyes are symmetric. His nose is midline, no deformities. Mouth is symmetric also. I'm going to ask you to close your eyes for me. Close them tight. Open them wide. Furrow your brow. Make a sour face. Puff out your cheeks. Smile for me. All that is normal and symmetric. I'm going to palpate Mr. Crosby's temporal arteries. And those are normal. Now I'm going to listen to them. I'm going to listen for any bruises. Which I do not hear. Next, I'm going to assess Mr. Crosby's jaw and neck. Lift your chin up for me. His neck is symmetric bilaterally. Put your chin down for me. Open your mouth for me. Close, open, close. I do not feel any crepitus in his jaw. I'm going to have you turn your chin to the right for me. Now to the left. Touch your chin to your chest. Up. Now your ear to your shoulder. Right ear to your shoulder. And left ear to your shoulder. And all that looks normal. I'm going to have you sit up on the edge of the bed now. I'm going to check your thyroid. Turn just a little bit. Lift your chin for me. Swallow for me. Okay. No enlargement or nodes noted on that thyroid. I'm going to auscultate his thyroid now for bruise also. And I did not hear any. You can sit back. Next, I'm going to assess Mr. Crosby's lymph nodes. They run from in front of his ears, all the way down his chin, the back of his ears, and all the way down his neck. Any of that hurt? Shrug your shoulders for me. I don't feel any enlargement, so no lymphadenopathy noted. Sit you up just a little bit. Okay. Next, I'm going to assess Mr. Crosby's mouth. Open your mouth for me. Stick out your tongue. Tongue is normal. Say ah. Okay. Open. Okay. Put your teeth back. Teeth are normal. Color is normal. Okay. No lesions or anything noted. All that looks normal. I'm going to check Mr. Crosby's ears. Again, they are symmetric. You've already determined that. Does that hurt?
No.
Can I do that? Does that hurt?
No.
Any of that hurt?
No.
Any pain there?
No.
No? No debris noted in that ear. And no debris noted in that ear. Next, I'm going to check Mr. Crosby's nose. Again, it is symmetric. I'm going to check for any inflammation or drainage, which I do not see. Mr. Crosby does have a lot of hair, so it's hard to see a septum, but it looks as if it does not have a deviation to it. I want to check the patency of his nares. I want to include this one. Sniff. Okay, that is normal. Sniff. All right, that is normal also. Next, I'm going to check Mr. Crosby's sinuses. Press on his frontal sinuses. Do you have any pain there?
No.
Can I do that? How about right here?
No.
All right. Those all feel normal also. Does this hurt?
No.
All right. Next, I'm going to assess Mr. Crosby's eye. I'm going to look at it. See if they're symmetric. Look at me. They look symmetric. His pupils look normal. Right now, I'm going to turn down the light. Look right at my nose. Pupils are equal and reactive to light. Look at my nose again. And accommodation. Look at my nose. Watch my finger. Convergence is normal. His eyes did turn inward. I'm going to have you sit on the edge of the bed. I'm going to check your peripheral vision. I want you to hold this in your hand. I want you to cover your right eye for me. And I'm going to cover my left eye. And I'm going to bring a light in. Side, up, down, and the other side. Whenever you see the light, I want you to tell me now, okay? Let me turn the light off again. Or down.
Yeah. Now.
cover your other eye. Are you ready?
Now.
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 And here. Okay. His peripheral vision is normal. I'm going to assess Mr. Crosby's neck now. Could you lift your chin up for me? Everything looks symmetric and normal. His trachea is midline. Sit up. Next thing I'm going to do is check your eye muscle movement. If you could follow my finger, please. And that all looks normal. Now, Mr. Crosby, we're going to do a visual acuity test. I'm going to sit you up just a little bit more. I'm going to open this door over here. We do have an eye chart out in the hallway. I want you, when we open the door, to start at the top of the eye chart and read all the way down, reading left to right, until you get to a line that you can no longer read, okay? You understand that?
Yes.
Right. Can you see that with no problems?
Yeah.
Okay. Start at the top and read on down.
E F P T O Z P D C L P E D P E C F D E D F C Z P F E L O P Z D D E F. That's about it.
Okay. That. Both eyes, or OU, Mr. Crosby is 20/20. You take this card and cover your left eye for me and read the same chart.
E F P T O Z P D C L P E D P E C F D E D F C Z P F E L O P Z D D E F P O T Z C.
All right, and Mr. Crosby's right eye is 20/20. Cross over to the right eye and read with your left eye.
E F P T O Z F D C L P E D P E C F D E F E D F Z O P F Z. That's about it.
Okay, and Mr. Crosby's left eye is 20/25. Thank you, Mr. Crosby. I'm going to give you another. And that, we tested your distant vision there. We're going to test your close vision. I want you to hold this card in your hand. And the same thing, read the letters until you can no longer read them again.
9587428843639254283853742588378. Okay.
Okay, so that's 20/25 on that chart. I'll cover your left eye. Go with your right eye again.
958742838 correction 284363888745 63925 42836537425 9378284. Can't make that up.
Okay, and that would be 20/25 in that eye, which is the right eye, and we're going to go with the left eye.
958742843 958742843 638 8745 93. I can't make that. I can't make that up.
So you stopped right here?
Yes.
Okay, so that's 20/50. Guys get tired?
Yes.
Okay. Mr. Crosby, we're going to do a breast exam on you. Do you ever do breast exams?
No.
Okay, lift your arms for me. Do you have a history of breast cancer in your family?
No.
Anybody in your family ever been told they have the BRCA1 or BRCA2
No.
gene mutation? There's two ways you can do a breast exam. You can do the concentric circle method, like I'm doing now, just going in circles. Or you can do the vertical strip method, which you go up and down in vertical strips. Alright. Feels normal. No lumps or nodules noted. It's important to go in
into the axillary area because you do have lymph nodes and breast tissue up into that area. Alright. And if you wouldn't mind, I'm going to have you show a breast exam to me on yourself. I'm going to start up here. I'm going to go all the way around the breast, checking for any abnormalities, nodules, lumps. You circle all the way around till you get to the nipple. Alright, and the other side. And it's important for men to do breast exams on themselves, especially if they have a family history of breast cancer, because men can get breast cancer. Okay?
Okay.
All right. I'm going to set you up some. We're going to look at your lungs and chest. Mr. Crosby is breathing normally. His rate and rhythm are normal and even. There's no dyspnea, shortness of breath noted. Do you have any history with asthma, colds, common colds, anything like that? Okay. All right, we'll listen to your lungs real quick. Deep breath in. Let it go. Again. Let it go. Again. 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 Put your arms down for me. Again. And again. Okay. Sit up for me. Sit to your back. Again. Let it go. Again. Okay, you can sit back. Breath sounds are clear to auscultation. No adventitious lung sounds heard. Mr. Crosby's chest is normal. He has no pigeon chest or barrel chest noted, or funnel chest noted. Any questions on the lung exam?
No.
Or auscultation in the lungs? All right, we're going to look at your heart now. Any cardiac history?
Yes.
What kind of history do you have?
2 stents.
2 stents, so you've had a heart attack?
Yes.
How long have you had your stents?
7 years.
Any problems since then?
No.
All right. When was your last stress test?
2011.
It was normal?
Yes.
All right. I was checking while Mr. Crosby was answering questions, I was checking his capillary refill. His capillary refill is normal in less than 2 seconds. I'm going to check for edema. Any problems with swelling in your ankles, legs, feet, hands, face? Any swelling? Okay. No edema noted. I'm going to check your pulses. This is the radial pulse. Bilaterally, they are normal and symmetric. Relax your arms now. Check your brachial pulses. They too are symmetric and regular. Check your posterior tibial pulses. They are both normal and regular. And your dorsal pedis. And they are both normal and regular. I'm going to have you turn over to your back so I can assess your popliteals, back of your knees. I'm going to put your head down. they are both normal and symmetric also. You can roll back over. Off a bit, please. All right, I'm going to listen to your heart and your carotid arteries. Turn your head for me. No clicks, rubs, or murmurs heard. His carotid and his apical pulse are symmetric. I'm going to listen to your carotids now. I'm checking for bruits or any turbulent blood flow through the carotids, which would indicate stenosis. Okay, turn your head for me. Okay, no bruits noted. All right, I'm going to assess Mr. Crosby's level of consciousness based on the Glasgow Coma scale. It measures level of consciousness based on the best eye, best motor, and best verbal response, and is graded 1 out of 4 or 6. For eyes, it's 1 to 4, and Mr. Crosby scores a 4 since he can open his eyes simultaneously or spontaneously with no problems. And his best motor response gets a 6 because he can follow all commands. And his best verbal response is 5 because he is alert and oriented times 3. So his Glasgow Coma score would be 15. The next thing we're going to do is test your cranial nerves. There's 12 of them, and I'm going to go one by one. We're going to start with your olfactory, or your smell, and I'm going to have you sniff some stuff and tell me what you believe it is, okay? I'm going to have you close your eyes. I'm going to push on one of your nares here. Sniff for me. And tell me what you think that is.
Coffee.
Very good. It is coffee. Again.
It's been anything.
Again. Sniff.
Coffee.
Very good. That is coffee. One more. Keep your eyes closed for me. Again. Sniff.
Vanilla.
Very good. It is vanilla. And again.
Vanilla.
Very good. So Mr. Crosby's cranial nerve 1 or olfactory nerve is normal. You can open your eyes. I want to give you something to read. Again, we're going to take the Romberg eye chart, and I just want you to read these letters, these numbers right here for me. This is testing Mr. Crosby's optic cranial nerve, or cranial nerve number 2.
26, 14, 10, 8, 6, 5, 4, 3.
And can you read that sentence for me?
Card is held in good light at 14 inches from my eye. Record vision in each eye, for each eye, separately with and without glasses. Pre-bospic patients should read through bifocal segment. Check biopathy. MOPS with glasses only.
Very good. So Mr. Crosby's cranial nerve 2 or optic nerve is intact. We're going to do the oculomotor, the trochlear, and the abducens all together. It's cranial nerves 3, 4, and 6. And we've actually already done some of it, and it tests the eye movement of the eyes. And again, I'm going to have Mr. Crosby follow my finger. Or actually, we're going to have him follow this pin. And that is normal. No nystagmus noted. We're now going to do, excuse me, cranial nerve number 5, or the trigeminal. Mr. Crosby close his eyes for me. I'm going to touch your face, and I want you to tell me now whenever you feel the touch, okay?
Now. 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 Now.
Okay, and that is normal. I'm going to have you open your eyes for me, clench your teeth together. Okay, and his muscle strength in that jaw is normal. Open your mouth, close it, open it, close it, and that is normal too. So Mr. Crosby's trigeminal cranial nerve number 5 is normal. Cranial nerve number 7 is, we've already assessed, and that's where I had him squinch his face, lift his eyebrows, but we'll go through it again, and this is for his facial nerve. Furrow your brow for me, raise your eyebrows, puff out your cheeks, make a sour face. Okay, very good. Smile. All right, and all those are normal. So his cranial nerve number 7 or facial nerve is normal. The next cranial nerve we're going to check is cranial nerve number 8 or the vestibular ocular, which is hearing. Now Mr. Crosby does have a hearing deficit, so we're going to do this the best that we can. I'm going to whisper something into your ear, and I want you to tell me what I've whispered, okay? All right.
This is testing your hearing.
Very good. We're going to do it to the other side.
I am testing your hearing.
Very good. So Mr. Crosby's cranial nerve number 8 or vestibular ocular nerve is normal. We're going to do cranial nerves number 9 and 10 now. His glossopharyngeal and his vagus nerve. We've already done this a little bit. Let me get a tongue depressor again. Excuse me. Open your mouth for me. Say ah. Okay, and that is normal. Get a light. Open your mouth. Stick tongue out. Try again. And we're looking for the raising of the soft palate, which it did. So that is normal. I'm going to stimulate your gag reflex just by touching the back of your throat. And he did gag, sorry about that. And I want to have him drink something to make sure that he has no swallowing difficulties. And this is water. Please drink that for me. Or just a little bit, you don't have to do a lot. Any problems there? The problem's getting it down. All right. So Mr. Crosby's glossopharyngeal and vagus nerves, cranial nerves number 9 and 10 are normal. Excuse me. We're going to assess cranial nerve number 11 now, or the accessory nerve. I want to have you shrug your shoulders, put them down, turn your head to the right, turn your head to the left, put your ear to your shoulder, put your other ear to your shoulder, put your chin down, okay, and I'm going to have you look up for me and push against my hand, okay, and again, all right, and all that is normal, no deficits noted, so cranial nerve number 11 or the accessory nerve is normal. Excuse me. We're going to assess cranial nerve number 12. This is the hypoglosseal, or the tongue. If you could stick your tongue out for me. To the right, to the left, up, and back in. Very good. All that is normal. So his cranial nerve number 12 is normal and no deficits are noted. Next, we're going to assess his discriminatory sensation. Any abnormalities in this area would indicate some kind of cortical disease. All right, Mr. Crosby, the first thing I'm going to check is called stereognosis. And I'm going to put some different objects in your hands while your eyes are closed, and I want you to see if you can recognize them, okay? Close your eyes for me. Let me see your right hand. Can you tell me what that is?
Key.
Okay, very good. It is a key. Let me see your left hand. Tell me what that is.
Rubber band.
Very good. It is a rubber band. One more time. Right hand.
Coin, maybe a quarter.
Yep, very good. It is. And one more time, left hand.
Same, quarter.
Very good. All right. Next thing I'm going to do is called graphesthesia. I'm going to draw something on the palm of your hands, and I want you to recognize and tell me what you believe it is, okay? Let me see your left hand. Turn it towards me. Very good. I did draw a 3 on the left hand and a 6 on the right hand. The next thing I'm going to assess is point localization. I'm going to touch your body in 2 different spots, and I want you to tell me whether or not you feel the difference, okay? Let me see your finger.
Yes.
Okay. And on this hand.
Yes.
All right. And your arm.
Yes. Yes.
And on your feet.
Yes. Yes.
Very good. So no abnormalities noted there. Next thing I'm going to do is assess Mr. Crosby's strength. Let me see your hands. Pull me towards you. Very good. Don't let me pull you. Okay. Push down. Okay. Push up. Very good. All right. Same things with your legs. Push up. Okay. Same one. All right. Lift your legs for me. Push down. Very good. All right. And feet. Push against me. Push against me. And pull towards me. All right. We'll pull towards you. Very good. And all that is normal and equal bilaterally. No deficits noted. Next thing we're going to do is assess Mr. Crosby's reflexes. I'll have him sit up just a little bit. All right. Just relax your arm. Get over to the side of the bed just a little bit more for me so we can bring up this arm a little bit more. Easier said than done. All right. We're going to test your deep tendon reflexes. I'm going to start with your biceps. Just dangle your arm off to the side just a little bit. Okay. And I did feel Mr. Crosby's arm flex there. All right. And that one too. And that was normal. Just let me have the weight of your arm here. This is his tricep for testing. All right, that one was normal. And again, let me have the weight of your arm. All right, and that was normal too. I'm going to have you swing around to the side of the bed here so I can test your patellar reflexes. Just dangle your legs off the side of the bed there. Come a little bit. There you go. Okay. And that one's normal. All right. You can go back to the bed. Turn around back onto the bed. And his deep tendon reflexes are normal. The next thing I'm going to do is assess your abdomen. I'm going to listen first. Any problems with your abdomen?
No.
Any nausea, vomiting, diarrhea, constipation?
No.
Any pain when I press?
No.
All right. Mr. Crosby's abdomen is normal, and his bowel sounds are normal too. No hypo or hyperactive sounds noted. The last thing we're going to do is we're going to assess your coordination and balance. I'm going to have you stand up for me. You stand up at the end of the bed here. Close that for you. I'm going to move the bed back so you can have a little room. Alright, first thing we're going to do is finger to nose. And just to practice, I want you to put your arms out to your side. Finger to nose. Finger to nose. Alright, now close your eyes and do it. Finger to nose. Finger to nose. Alright, that's normal, no swaying noted. The next one we're going to do, you can open your eyes now. Next one we're going to do is heel to toe walking. Just heel from one foot in front of the toe of the other and just walk in a straight line. All right, very good. You can return. No swaying noted, that's all normal. The next one we're going to do is have a seat back on the bed for me. I'm going to take your hands and put them on your lap. And we'll flip them over. I'm going to do that very fast. Very good. Normal on that too. Next one we're going to do is we're going to have you stand up. I'm going to have you close your eyes and just hold that stand right there for me. And I'm checking for swaying. This also checks the cranial nerve number 8. No swaying noted. You can have a seat for me. The last thing we're going to do is called pronator drift. This checks, especially if somebody's coming in with stroke symptoms, if you would hold your hands out, palms up for me, and close your eyes and hold it there. And that is normal. There is no pronator drift. If there was, one of the arms would tilt down, and that would indicate possible stroke. All right, and that concludes our physical assessment for today. Thank you, Mr. Crosby. I would like to note that Mr. Crosby is my husband, so with a normal patient I would use gloves, but however, since he is my husband, I did not. Thank you.